Immunotherapy agents are associated with some really unusual toxicity profiles, and the partnership between acute oncology, the triage helplines within the cancer centres and immuno-oncology teams is going to be paramount to increase patient safety, but also to do some health promotion and awareness. Early recognition of these symptoms enables early management, which helps to prevent them becoming life-threatening, and that's really vital going forwards in the management of these patients. Ipilimumab is an immunotherapy treatment that we've been using for the last few years now. Historically, chemotherapy treatments haven't been very successful in the treatments of metastatic melanoma, so ipilimumab treatment has really revolutionised the care and brought out further treatment options to extend the overall survival of this group of patients. For the last couple of years, I've been developing a telephone assessment service for patients receiving ipilimumab treatment. This is primarily addressed at addressing huge waiting times within the treatment unit. This is because ipilimumab is a high-cost drug with a short shelf life, which means that it isn't made up until the day of treatment, and patients have to be assessed as being suitable and fit for their treatment. So historically, patients have waited 4 hours, up to 4 hours and more, to receive that treatment, which I found wholly unacceptable. So my main focus was to get those waiting times down to enhance their experience and also reduce all the anxieties that go with waiting around in hospitals for long periods of time. So I piloted this service over a year. I had 3 main objectives. The first one was obviously to reduce waiting times. The second time was to assess the safety. Is it safe to be assessing these patients over the telephone? And the third one was to identify if there were any unnecessary risks associated with the service. And I'm really overwhelmed and happy to say that the waiting times have been reduced by about 93%. So now the average time that a patient has to wait to receive treatment is around 17 minutes. And I've had no issues with any safety concerns about assessing patients' fitness for treatment over the telephone in the last 2 years. Telephone assessment services aren't a new idea, but it's thinking outside the box to try and improve the patient pathway and coordinate it better to enhance the patient experience. We don't want patients waiting around in hospitals for long periods of time. Not only does it add to the financial burden, but it also adds to the psychological burden as well. So thinking outside the box and trying to encompass all types of telephone medicine into assessments to speed up delivery and improve care could be really beneficial for other centres alike.